Quick question. Are you an EMT student or maybe a medic student and you're having a hard time getting through your head to toes quickly and efficiently? Well, let's go over it. Now, before I start doing my head to toe on Charlie here, we got to talk about DCAP BTLS. Okay, remember DCAP BTLS is something that we do say. First, I want you to be able to say it quickly. We got to know what it means. D stands for deformities. Whenever I'm using my DCAP BTLS, by the way, I'm looking at my patient. I'm looking to see if they have these, right? Deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, laceration, and swelling. This is your DCAP BTLS. We're looking for these things in our secondary exam when we're performing a detailed head to toe. All right, so the first thing I want to do is I want to show you how to do a detailed head to toe, and I'm going to be detailed in the beginning, but then I'm going to do it quickly to show you how to perform a fast detailed head to toe for your scenarios in school. Now, what I'm doing is I'm focusing on the head, ears, eyes, nose, mouth, and throat, right? I'm looking to see what are my patient's pupils. Do I notice any drainage from the ears, eyes, nose, or mouth? Do I notice any teeth that are in the mouth? Any battle signs or bruising in the mastoid process, right? When I come down from the head, before I come down, I always want to sweep the back of the patient's head with my gloved hand, and I'm looking to see if there's blood on my glove, or if I feel any sort of hematomas or lumps. Once I come down on my patient's neck, I'm looking for three things. You have to say the three things: tracheal deviation, JVD, and stair stepping in the back of the patient's neck. Okay, that's just telling me that my patient has potentially a broken cervical spine. Coming down the chest, I always feel my patient's clavicles to ensure that they're intact. I'm looking at their chest for any subcutaneous emphysema, or that's air underneath the skin. And then I'm going to check the patient's chest. Now, this patient looks like they had a wound. Let's go ahead and remove that. I'm going to go ahead and take a look at my patient's chest. There's three things that I always check for. I call it the IAP: inspect, auscultate, and palpate. What does that mean? I'm inspecting. I'm looking for any DCAP BTLS. I'm palpating for any DCAP BTLS. How we do that is I wrap my arms or my hands around the patient's chest. I tell them, take a deep breath, and I feel for any crepitus or any bones grinding against each other. Then I auscultate, and I check my patient's lung sounds. From there, I'm going to go ahead and quickly assess my patient's abdomen. Ensure that it is soft, non-tender ×4. I ensure that my pelvis is stable and intact. Never rock the pelvis, right? Gentle pressure to ensure that pelvis is intact. I'm looking for any incontinence or priapism. Coming down the legs, checking my pedal pulses, cap refill, ask my patient to wiggle their toes. And again, I'm looking down each leg and I'm feeling down each leg. Same thing with the arms. I'm coming up, feeling down the arms, checking cap refill, radial pulses, looking for any medical alert bracelets. Doing that on both sides. Last thing I'm going to do is sweep the back. So I'm going to go ahead and log roll this patient. And I'm assessing their back. Looking for any sort of DCAP BTLS. And then that's how I'm doing my full head to toe detail. All right, let's pick up some speed. Okay, I'm checking the head, ears, eyes, nose, mouth, and throat. I'm looking for any deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, laceration, and swelling. Checking the pupils, anything in the mouth, ears, eyes, nose, or throat. Tracheal deviation, stair stepping, JVD. Checking the back of the head, and I'm checking for stair stepping, clavicles intact. I'm going to go ahead and inspect, auscultate, and palpate the chest. Abdomen, soft, non-tender ×4. Pelvis, stable, intact. Negative priapism, negative incontinence. Coming down the legs, pedal pulses, cap refill. Anything inside the pockets. Checking down the legs, coming down the arms, radial pulse, cap refill, any medical alert bracelets. Same on this side. And then I'm going to go ahead and sweep the back.